The second conference of EB-CLINET, the clinical network of EB centers and experts, took place from September 17th to 18th, 2013 in Salzburg, Austria. 91 delegates from 29 countries across the world exchanged their experience in the field of epidermolysis bullosa. The program included presentations of complex clinical cases, an update on clinical studies, as well as lectures and workshops on defined EB-CLINET work packages. The conference was opened by Dr. Stokel, member of the County Government of Salzburg, Dr. Rainer Riedl, CEO of DEBRA, Austria, Managing Director of the EB-Haus and President of DEBRA International, and Professor Helmut Hindner, the head of the Department of Dermatology, Paracelsus Medical University, Salzburg. Professor Hindner, 3 years ago you had the idea to build up a clinical network in the field of EB. Why is it so important to have such a network?
Well, I think the future will be multidisciplinary care for the patient and networking, because the world is getting smaller and smaller, and the money for medicine is getting less and less. And therefore, I think the most important is the exchange of knowledge, and the best way to exchange the knowledge is a network.
Dr. Paula Gubo, you are one of the driving forces behind the EB-CLINET project. Where are we?
Yeah, we are quite far. Within 2 years, we have founded CLINET in 2011. And in the meantime, we have defined work packages, meaning we are working on clinical practice guidelines, on education and training. We're looking to establish a global EB register. So many work has been done in the meantime.
Dr. Riedl, why is EB-CLINET so important for DEBRA?
There is a long tradition that patient support groups, DEBRA, meet each other. We started that about 20 years ago, and about 10 years ago we started to link together, to connect the researchers. What we didn't have was a network of experts, of clinicians, and this is the idea of the EB-CLINET network, to bring them together and to work on issues like registries, like clinical guidelines, like professional education. So this third arm in our EB world is a very important resource.
Mr. Dart, what do you think is the value of EB-CLINET?
I think EB-CLINET has, in a very short space of time, proved the tremendous value that it has, not just for professionals, but the EB world as a whole. I think, in the space of a year, to have 52 members, 43 countries, including not only the major world centres, but also lots of the smaller ones, bringing up standards there.
Professor Bruckner Tudelman, why is it so important, especially in the field of professional education and training, to pull together all the resources we have?
Professional training is extremely important for a rare disease like EB, and we have so much expertise in different European centers, and it only makes sense to combine this and have as many people trained as possible.
Dr. Van de Akker, you are leading the EB-CLINET task force on EB registries. Why do we need an EB register?
Well, I think you can define many reasons why we need an EB register, but together we define that the primary reason to start a project should be to be able to identify and recruit patients for clinical therapy trials. So I think that is the major reason why we are doing the project, but there are many more reasons you can think of.
Dr. Krima, you have written the first clinical practice guidelines about dental care in EB. What should other groups who develop new guidelines consider?
Teamwork. I think it's all about teamwork and getting everyone involved, getting clinical experts, getting patients, patient representatives, getting lay people involved as well, because they have different ideas and everyone can contribute to some extent. So I think teamwork and getting different realities and perspective is very important.
Lawrence Sharnas, you're coming from Shire Pharmaceuticals. What do you think is the value of the EB-CLINET project?
I think there are multiple areas in which EB-CLINET project adds value. The most important is that it creates a community for sufferers of EB around the world. It allows patients, patient advocacy organizations, researchers, physicians, and companies trying to develop therapies to get together in an environment where people feel part of the family and understand the mission. It's been a wonderful experience to see people get along, to challenge each other, ask questions that need to be asked, and figure out a path forward.